This is Body Composition and BodyMetrix for the Caribbean, explained by SoundBodyScience.com. As a Caribbean health professional, you know that according to the World Health Organization, deaths caused by cardiovascular disease and diabetes are much higher for both men and women than the global average, and that obesity-related morbidity is among the leading causes of mortality in almost all of the Caribbean. 60% of men and women over 30 in most of the region are clinically overweight, 30% of females are obese, and on at least 2 islands, there's over an astounding 60% obesity rate. We can all agree that one of the greatest threats to future health is that obesity among our children has surpassed the United States. Meet Dr. King and her patient, Carol, who's been gaining weight for 5 years. She is borderline diabetic with hypertension and a BMI of 28.5, heading towards obesity. Nothing that Dr. King has prescribed about changing lifestyle or diet has produced long-term results. Carol has given it a good effort, but her weight has remained about the same, and her scale's body fat percentage fluctuated up and down, no matter how hard she worked out or how disciplined her diet. Carol didn't understand that weight doesn't always change, even though she was getting healthier, and that hydration and food intake makes bioelectrical impedance frustratingly inconsistent. She interpreted this as her own failure, became frustrated, and resumed her unhealthy lifestyle. Right after seeing Carol, Dr. King met with a gold medal javelin thrower who was about 10 pounds over his competitive weight. His BMI, at 28.5, was the same as Carol's, making him, according to the BMI formula, close to being obese. She knew, of course, that his body composition and Carol's were on opposite ends of the scale, but she didn't have the time or an easy way to show Carol what that meant. Dr. King knew she couldn't manage what she wasn't measuring. She needed a precise, easy way to measure her patient's lifestyle changes, and realized that total body composition was the answer. She started to research how to measure it quickly and accurately. Her time spent on each patient was a key factor, and cost was important to both her patients and her practice. Bioimpedance was inexpensive but inconsistent. Cost ruled out X-ray CT, MRI, DEXA, and displacement methods. She tried calipers, but her results varied too much with different nurses, and anyway, she had read several studies concluding that errors compounded on obese subjects, so calipers were out. Then she found BodyMetrix, an ultrasound technology used by elite athletic teams and trainers to measure and track extraordinarily accurate body composition in about 4 minutes. Now, using BodyMetrix, Dr. King's nurses measure body fat and lean muscle mass with a laptop and wand, while they're taking each patient's pre-exam vital signs. Age, height, weight, gender, and other measurements are quickly input into the BodyMetrix program. She has a customized color report in hand when she meets her patients, with pie charts showing healthy and unhealthy body fat, lean body mass, disease risk graphs, and more. Now she can accurately monitor the effects of diet and exercise. She knows if her patients are starving themselves to lose weight because she is measuring muscle mass, and she can use the same assessment to measure and track her chronically ill and elderly patients. Dr. King now has her overweight and obese patients come in for a quick and inexpensive body composition assessment every 6 to 8 weeks, and has found that the accurate feedback from BodyMetrix has validated and reinforced her prescribed lifestyle and diet changes. She has not only strengthened her relationship with her patients by tracking their individual progress, she's getting tangible, measurable results for her patients and her practice.